Tonight's program is brought to you by African Immigrants Dream Incorporated, a non-profit organization that serves low-income families and skilled professional immigrants. The mission of our non-profit is to ensure that low-income families and our professional immigrants are able to pursue their dreams here in the United States and also abroad. Our programs are in parts. We focus on health education, health promotion, career advancement, and professional assimilation programs. We also do medical supplies to Ghana. We have it as developing country, but our focus is in Ghana. And recently we started a free clothing distribution in our community because we noticed that there's been long lines in the thrift stores, and even used clothes are very, very expensive now. So we are trying to organize these programs to help our communities. But tonight we are going to talk about Medicare. And Medicare is one of the aspects of the complex United States healthcare system. And you know, for us immigrants, it's very, very challenging when we are working through issues like healthcare. And tonight we have Dr. Prince Baawuah here to walk us through this Medicare. We did part one last week, and he found out that people have a lot of questions. So he has volunteered again tonight to continue with this program. Our organization's programs are all free, but we are able to do so through generous contributions from our clients. So I'm asking if all of you can go to our website at www.myafridreams.org, click on donate and support us to continue with our work. December is a time for giving, and December 2nd is the Global Day of Generosity, where people give. So we are encouraging all of you to support us that way. I'm going to say a little bit about Dr. Prince Baawuah. I think most of us know him. Dr. Prince Baawuah is a leading health system literacy speaker who transforms events into empowering experiences. He has extensive experience in the U.S. healthcare system, especially in Medicare Advantage. And Dr. Baawuah delivers addresses at conferences, corporate events, schools, and seminars. He's also known for breaking down complex topics to help his audience gain clarity and to effectively apply the knowledge to their life. Dr. Baawuah, when you go to his website, is hillsacademy.com. He accepts speaking requests. So if any of you, after this event, you want to invite Dr. Baawuah to your church, go to the website and book him so he can come and support your group. I think I did not tell Dr. Baawuah, I know he speaks Spanish and he speaks Twi. We are making the platform a little easier. So some of the questions we can accept in Twi, but the responses will be in English. Thank you so much and welcome once again. Thank you, Dr. Baawuah. You are welcome. Thank you.
Yeah, thank you so much, Auntie B, for the work that you and the team
Oh, and it's what about me. That's my life right now.
African Immigrants Dream. I remember when we started like 3 years ago now.
Yes, yeah,
Yeah,
3 years ago.
3 years ago now, and seeing all the things that God has been able to do through you all with the dedication and effort. So thank you all. And everybody, good evening. Thank you for joining us once again for understanding Medicare. We did part one, I think it was 2 weeks ago. Um, And so I'm hoping that you haven't forgotten what we learned in our first session, because we will be building on that one. If today's your first time that you are joining us, we can see how we can get a part one on, so that you can learn from some of the basics. Um, because we had more questions from the last time, the goal for today is to go through some of our continue on from where we left off last 2 weeks and build up on that, but we will leave much more time for more questions. I know this is very complex, so if we need more time, we can always talk to Mrs. Beatrice to find more time. Yeah. So I will share my screen and we can proceed on today's. Okay. So we are uh, going through Medicare, and Medicare is part of the health system last time, as we discussed on. So understanding Medicare have fundamentally some principles of our health insurance, because it's a health insurance in America. So there are some things that maybe the terminologies may be different in Medicare as opposed to some of your own, either from what you get from your employer group or sometimes you get from Medicaid, but it's fairly similar in some ways. So we will go through that. And here are my contact information. You can go to our website, join on LinkedIn, and also I'll share my, I think my phone number is on the last slide. Um, there was this article that came out, I think within this last 2 weeks, and it really touched on why we need what we are doing. And I will quickly touch on the article as I go through it, because it's about Medicare. And I can say many immigrants, especially if we are in coming from Africa, when you are filling forms, then it says race and ethnicity. You don't check Ghanaian. Many of us check Black, African American, right? So, and we all bundle together in that way. So this is very important. And just a little snippet from the study, and it came out like 2 weeks ago. It says, according to the new study led by researchers from at Brown University and Harvard University, which found that a rising number of premature deaths prevent many Americans from reaching the age of Medicare eligibility. So people are dying young, right? And therefore, because of that, they are not able to reach the Medicare eligibility age, which the last time we studied together, what was the age again? 65, right? 65. So many people are dying early such that they don't get to 65. And in that case, what is happening is that from 2012 through 2022, deaths among adults 18 to 64 increased by 27%, according to the analysis. The trend is especially true, and I want to emphasize this, especially true for Black adults, which all of us are, who saw 38% increase in premature deaths over a decade, compared to 28% among white Americans. It was published in JAMA. All right, so this part is very compelling. These are people who contribute to Medicare their entire lives, yet never live long enough to use it. So from the time you immigrated to the US, you pay every 2 weeks will be taken from your paycheck, taken from your paycheck, taken from your paycheck. But you are likely not going to get to 65 years to qualify for Medicare. Uh, when you look through the lens of race, it is clear that one group is increasingly dying before they ever see the benefits of the system they help funded. When I saw this, it was it really hit me. And I, unfortunately, both my parents passed away, and I went to look at their age that they passed away. None of them got to this age. I looked at that's part of our church, NAXDA. You go through a lot of the funeral announcements and things, and you're like, many people don't even get here. we will work and work and work and work, but unfortunately we don't get here. And that is one of the important things why we are doing what we're doing, because knowing some of the things, it may be cost, it may be finances, it may be education, whatever it is, we want to be able to, as long as God gives us life, we want to be able to use this to our advantage because we help fund it, as you live here in the US. So thank you for organizing this, Auntie B, for us. So we will go through what we covered last time, just a little bit to just get us recap, and then we can go on to today's. So last time we did the Medicare, we did a summary of that. And we learned that Medicare is a federal insurance, right? It's an insurance program for people 65 and above, or those that qualify. If you're below 65, you have to have some disabilities, ESRD, end stage renal disease, or ALS, right? And we learned about the different parts. So part A is hospital insurance that covers inpatient hospital stays, skilled nursing facilities, hospice, home health care. We learned about part B, which covers doctor's visit, outpatient care, preventative services. That's part B. We learned that part D is optional, um, and but it covers prescription drug medications, which is pretty much what you get. You see you see a provider, you're either admitted to a hospital and you need medications. Those are pretty much healthcare. uh, you get the other things about maybe dental and vision and all the other things and senior ancillary benefits and things, but basically the core key areas are these things: hospital, medical, and prescription drugs. And we also learned that the ways that we can get coverage, I would have quizzed this, but it will be chaotic with all the Zoom things. I don't want people to be unmuted. But um, the way we all can get coverage through it, once you hit the 65 or you hit the qualification, you can either receive coverage through the original Medicare pathway or the Medicare Part C pathway. In all of them, Medicare or the original Medicare, you get your hospital insurance, you get your Part B, which is your medical insurance. You have to add your own Part D, which is the prescription drug, and there's a Medigap. We didn't get there because that is a whole different thing that we may have to take time to look at that one. Um, or you may choose your coverage type through Part C, which is all in one. It bundles all of them together. You'll get a Part A benefit, Part B benefit, Part D benefit, plus other benefits, bundle all of them together, and this is how you choose your coverage. Either I want the bun, I want the burger, I want the lettuce, I want the all of them one by one, that you pull it together and you make your burger. Or you go to a maybe what is a burger place, Burger King, where they've already made it for you and you just choose your burger, or Chick-fil-A, wherever it is. You just grab your burger and you go, right? So that's the thought about it. There's actually, as I was I had forgotten that there's actually a third way, which is called PACE programs. How many of us have probably heard PACE? But it's a very small part of Medicare coverage type as well. We can spend some time to talk about PACE of itself, but PACE is a whole different way of Medicare eligibility as well, how you can get coverage through PACE. So you can do that. That's a third leg, but usually PACE is very small with so many other qualifications, but it's also it's also Medicare and Medicaid as well. All right, so that is what we covered the last time, and that is where we're going to build on today, as we go through the part two. How many of us have had the understanding that Medicare is free? I think I have heard like, oh, I paid my taxes, so Medicare is free. I think that in our immigrant community, and not even in our immigrant community, within the minority community, it's like, oh, Medicare is free. Oh, they brought me a charge. Oh, they brought me. It's like you have a surprise bill because we anticipated that Medicare was going to be free by the time we get there. And today, based on some of the questions that came in from last time, we want to go through some of our Medicare and understanding some of the Medicare things in terms of cost, because it helps one in preparing. I think one thing that I'm thankful for is that you don't want to get there before you recognize that, oh, Medicare is not free. You need to pay some money so that you can start preparing for it. So the goal of today is to understand some of the cost of Medicare, and how all of them play together, so that we are not surprised by it by the time we get there. Or if we are there, we can find ways that we can navigate through that together. I When I talk to Auntie B, the goal is to be able to give more time today for more questions. And depending on the questions, we can talk through and find ways that if we are not able to cover them today, we will find another time and see. But because it's too much, and I prefer not to overburden this process, because I mean, but I don't want people to be confused. I think if we keep it to one thing or a few things and you get it, I get excited for that one. I think that is more beneficial than trying to cover so many things and then you get confused by the time we leave here. So to the same way we did last time, to stick it to A, B, C, D, and the parts and the color and what Medicare was. Today we want to cover some of the costs that are associated with Medicare coverage. Um, and then we can take some questions afterwards, and then we can take it out from there. But that is the goal for today. Medicare is not free. That's the first thing that you want to have that in mind. Will be using this as a framework as we go through it. So you'll see me bringing this over and over. Original Medicare versus Medicare Part C. Original Medicare versus Medicare Part C. Original is A plus B. Then you add your D, you add your Medigap, which is the Medicare supplement. And then you have to find your vision, all those other things. Or you choose Part C that has everything together, and you go from that perspective. Um, so as we go through the we covered last time on Part A, the traditional route versus the Part C route. The question that logically we are looking at this, all right, you have to go and do your A, you have to go do a B, you have to go find a D. Now you're thinking through, all right, I don't know how many of you are like, there's a company called HelloFresh. HelloFresh just puts all these ingredients together and they'll ship it to you. So then you have to make your food versus some other company that already made the food and then like they just bring it to you. So original Medicare is like maybe probably as making jollof, right? Or something. So you go and buy all your ingredients and make it versus you go to Rahama or somewhere else and try to buy a jollof that's already made, right? The question is like, if this is making the choice together versus this where everything is together all in one, then why doesn't everybody choose this, or why do we have two separate things or three separate things here? Why does one choose one or the other? And you may be here where you are either getting into Medicare or you are helping somebody or for yourself or whatever it is, and you are thinking through, okay, why or how should I be choosing one over the other? And why choose original Medicare over Medicare Advantage? And I'll use the analogy. I use the food analogy, and I'll use the phone analogy, right? When you get an iPhone, when you get an Apple phone, right? An Apple phone, regardless of what it is an Apple phone. There's like they are all running one operating system called iOS, right? The I operating system is an iPhone. Regardless of if it's iPhone 13, 14, 15, they may have different versions of it and updates on it, but it's still running iOS, right? And it's on an Apple phone, regardless of what it is. It's on Apple phone. The hardware, the software are all produced by Apple. Nonetheless, if you get an Android phone, on the other hand, although all of them may be running Android, or the Android operating system, the phones are developed by different companies. So you may have a Samsung that is running Android on that. You may have a Google Pixel that may be running Android on it. You may have a Nokia I don't know if Nokia produce phones anymore, but you may have a Nokia that may be running Android on it. You may find a Motorola that may be running Android on it. You may have Blue that may be running Android. So Android has so many, the same operating system, but so many different phones, right? Um, that is how the Medicare, just think of it from that perspective. And it's interesting. As I was doing this, I was like, I think the core principles of America is pretty much in everything. You find it in communication, right? In our technologies, you find it in healthcare, you find it in many places, right? Um, in healthcare, you may think that is like all put together for you in terms of okay, it's traditional Medicare, might be like an iPhone. But on the Medicare Advantage plans, you may have a whole different versions of it. That you may have one that is being given by Aetna, you may have one that is given by Cigna, you may have one that is given by United, you may have one that is given by just guess the names, all the names. But on the traditional side, there's just only one, right? And that is how it's like, then why don't we have one fund? People may ask, oh, why just one healthcare? It's like, no, people's needs are different and people's goals are different. And therefore, the complexity that you see or the complexity that we see in healthcare is not by accident, it's by design, right? The same way you will see that in phones, but we don't usually, we don't bring that same mindset to like healthcare, but healthcare has a similar philosophies as you see in several parts of America. um, Basically different needs, different preferences, different costs affect what people choose. Why original Medicare, um and I touched on it just a little bit from last time, and also last, I think some of the questions that came in from last time we touched on it. Freedom to see any doctor nationwide or any provider nationwide that accepts Medicare. There are no networks, there are no referrals needed. It's like Medicare is freedom. Just like some Android users who say Android is freedom, right? Medicare Advantage, original Medicare or traditional Medicare is freedom. If a provider accepts Medicare and I am in Maryland and I go to Massachusetts, I don't have to worry about it. So far as the provider takes the Medicare card, the provider will take care of me. I don't need any networks. I don't need any referrals. I don't need all these things so far as I can pay some of these things. So original Medicare is called Freedom Freedom Medicare. I just termed that. Um, Consistent cost. There's Medigap, and I think it also call it Medicare supplement. But we haven't really went deeper into that. But that is to help pay with some of our Medicare cost shares. So you will find consistent cost across that. U.S. travel flexibility, coverage that works everywhere or anywhere in the U.S. Specialist access, you see specialists without referrals. It's best for frequent U.S. travelers, people with complex healthcare needs, those who want predictable costs. It's freedom. And the freedom you have, the more likely you might probably pay for that freedom, right? So that is original Medicare. There might be someone who travel maybe for work or travel to see their family, whatever it is. They just go from one place to another, all over the place. They may need a Medicare, traditional Medicare, instead of having Medicare Advantage. The other way, if you are someone you don't travel as much, you are just home, you are just in your area, all these things, then that is that maybe. But I was so someone who has like higher monthly premium, Part B, Medigap, Part D, most must purchase a separate dental and vision, more plans to manage. So those are things that are needed for Medicare, traditional Medicare. So if you are someone who is traveling, someone who just you want that freedom, then traditional Medicare is for you. On the other hand, if there is a Medicare Part C, you have lower monthly premiums, and there's a class that I also do. It's called Health Insurance IQ, and we talk about all the various terms. So I believe like for premiums, it's more like the monthly premium you pay for your like maybe your car insurance as well because it's insurance. So those are the monthly payments that you are doing for the traditional Medicare Advantage. Many of them have zero premium plans, you get extra benefits, often covering dental, vision, hearing, gem. Sometimes they sometimes give you a card, a a debit card that you can use to buy other things, which you wouldn't get in traditional Medicare, because the goal is to give people flexibility in some way. Your annual out-of-pocket cost is capped to about 5,000 to 8,000, depending on the plan that you choose. All in one simplicity is one plan, one card, and it's best for budget conscious, stay local, prefer coordinated care. But then what do you have to deal with? You have to deal with network of doctors. You cannot just get up from Maryland and just go to anywhere else in the U.S. and you pull out your Medicare Advantage card thinking like the people should take it. That doesn't work that way in Medicare Advantage. You may need referral depending on which one you have. You may need referrals to see a specialist. Then copay for every service that adds up. Less flexibility if traveling outside the service area. Plans can change, benefit can change. In the traditional one, it doesn't really change that much year over year. But for for Medicare Part C, it does change. Last week there was a question that was asked about United, right? There are United used to be here in Maryland. This year in 2026, as we get into 2026, United pull away from Maryland. There are some United plans that are in Baltimore County, but it's also limited to some Erickson community. If a plan doesn't think they will do well there, they pull out or they sell the company or whatever it is. So that is for Medicare Advantage. It's being managed by a third middle company in the middle. So they are pulling things together. You get more benefits overall, but you are exchanging, like, going to everywhere in the country versus a limited area of place that you can use your service. So there are some people that, hey, that is what they want. They may prefer a dental plan, but it's like, I don't go anywhere. I may travel once or twice, but it's like I'm almost always in this local area, which almost always in health research, many of us receive our healthcare services across here, right? I mean, Maryland, probably University of Maryland, Hopkins, MedStar, just around here. Hardly would I be traveling to Oklahoma for a service, right? That happens. So in that way, I would rather trade that going nationwide for some other premium, zero premium, or some benefits. So at the end of the day, what you are doing is you are looking at your situation, you are looking at your life, and then you are making the choice that suits you. Don't just take someone's blanket recommend. Oh, I use United, or I use Aetna, or I use for whatever it is, and it worked for me. Your situations may be different. It's always best to look at your situation, your need, or your upcoming needs, and be able to adjust and make those changes according to. And that is why there are complexity, or there are a lot of them, because people's needs change, and people are like, oh, health policy, like, not everybody is the same. So why do you give the same thing to everyone? All right, now let's have part C. And that is where I'm saying that it's complex by design, but ultimately that is the reason why there are so many things that we all have to deal with from that perspective. Um, so from a very summary wise, like, monthly cost for original Medicare is relatively higher. And last week, I think it was Dr. Amankwa that asked that question. Monthly cost for Medicare Advantage is relatively lower. Provider of choice from the original Medicare, any provider that accepts Medicare, which is fairly, I think, almost all providers in the US, just maybe a little few that may not accept Medicare. But ultimately, like, any provider that accepts Medicare, you can go to them. Um, from a Medicare Advantage standpoint, network limitations, there might be prior authorizations and all of the things that are needed to help manage care. And that is what Medicare Advantage is, a managed care program. Predictability is very predictable with Medigap, but copay, you have copays here that you have to deal with. Extra benefits, you have to buy them separately. This one is often included. Travel, it works nationwide. it's all limited to the service area for Medicare Advantage, and annual change is fairly stable. If you traditional Medicare, it's fairly stable. There might be some cost sharing and other things changing, but it's fairly stable. Medicare Advantage, it changes year over year. It changes year over year. So as you make your decision, these are some things. And the thing is, you can choose traditional Medicare one year, you can choose Medicare Advantage another year, you can do it, whatever it is. And within Medicare Advantage, you can choose one plan. You can, so as your needs change, you feel free to make those changes during the annual enrollment season. So um, that is the summary for the original Medicare versus the Medicare Advantage, and why one may choose one over the other based on their needs. Um, which coverage options do I have? Maybe you are thinking through like, oh, and I have talked to many people where I'm asking like, do you have this card, or it's like the first thing, do you have a Medicare Advantage or do you have traditional Medicare? And it's like, I have Medicare. All right, okay, let's try to figure this. Oh, do you have a card, your Medicare card, and you have it? Yeah, I do have another card. But as you go through and you go deeper, you recognize that, oh, they probably have traditional Medicare based on all the information, but there's a test of how you can quickly identify if you are in traditional Medicare or you're in fee for service, versus you're in MA. If you have traditional Medicare, you have your Medicare insurance card, which is the blue, white, and red card. Um, then, if you have a Part D, so usually when you go to receive either hospital service or medical services, you are mostly using your Medicare card, your blue, white, and red card. That's what you use. If you're going for prescription, then you have a card. The prescription drug is offered through a third company in the middle, Humana here, for example. These are the same companies that are offering Part C. So sometimes people get confused from there. Um, but you will see you have a Medicare Part D card, which is a prescription drug card. And how do you know that? Because you will see RX, 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 RX. So that tells you it's a standalone prescription drug plan. So you will have your Medicare card that you use for your hospital Part A, and medical Part B, um, mostly, and then you have your Humana or Aetna or United or whatever card that you use only for prescription drugs. Then if you have Medicare supplements, then you have your Medicare supplement card with it, the Medicare supplement with that. So it helps paying for some of the copays for some of the cost sharing from here, from that perspective. But if you want to know if you have Part C, on the other hand, you have your Medicare card. Your Medicare card, so far as you're Medicare eligible, you have your Medicare card, and you will have your Part C. Usually it's Part C and D card, um, C and D card, and you see here is a Blue Cross card. This one could have been Blue Cross as well, but I just used a different company I just found online and posted him here. But how you will see this is that when you receive care, this is your card that you are mostly using. Unlike the first one, you are mostly using this card and you use this for prescription. This one, you're using this card almost always, right? You have your HMO plan, which takes care of your A and B benefits, which is your medical and your hospital benefits. Uh, and then you can see your prescription drug in here, RX. So it's a combo, it's combining these and into this. And um, what it's pretty much doing is that you have your Medicare Advantage card that you use mostly. You may have a dental card on the side, you may have a vision card on the side, this one too, but mostly you will have this card that takes care of things. So to identify what coverage option you have, this is pretty much how you can identify. You're using this all the time, almost always. And with this, if you have prescription drug, then you have traditional Medicare, original Medicare. If you have a card, and you are using this card almost always, then that is our Part C, and then you can make those changes from that perspective. So that's how you can easily identify that. Most of the rest of the session is gonna focus here, and Medicare is not free. Medicare is not free. And we go through here again. The original Medicare with your coverage option and your Part C with your coverage option. Medicare, original Medicare, you have A plus B. You put together your own D with other things, and this one usually is an all-in-one that you're putting in here. And with the coverage option, I want to touch on some of the Medicare eligibility and the work credits because it came up last time, and it's also important um, as you go because that affects how much money you pay as you get. You get your 65. 65 is like you get your passport. Now you need a visa in order to go through, and these are some of the money, right? So federal health insurance program for people 65 and above. What is work credit? So you get to 65, but then there's another level of determination that is needed. So Medicare and Social Security work hand in hand. So credits earned through paying Medicare taxes while you're working. If you have your pay stub every 2 weeks, every month, wherever you have, you will see Medicare taxes on your pay stub, right? Medicare taxes on your pay stub is counting towards Medicare. Right. Sometimes what we forget or what we assume to be, oh, I pay my Medicare taxes. I pay my, by the time I get to Medicare, it's gonna be free for me, right? Because I'm paying it now, right? But as we go through the rest of the lessons today, you will see all these Medicare cost sharing avenues that are there. How to earn credit. So 1 credit per quarter, and the max is 4 credits per year. So it's a quarter. So every year, just like for the Adventists that are here, like Sabbath school. So there's quarterly. So every quarter, when a quarterly change, you have earned 1 credit if you are working and you're paying your Medicare taxes. And 2025 earnings, there is a earning threshold that is needed. So 1,810 earns 1 credit, and this is your gross revenue or gross pay that is coming in, 7,240 per year. You earn 4 credits for that. And credits don't expire, they stay with you for life. And in having Medicare, now we're going to go through some of the parts because, as I said last time, this is insurance. Don't forget that Medicare is an insurance program. And the same way when my car insurance, when I have a problem at home, maybe with plumbing, I don't go to my car insurance company for them to pay for the benefits. The same works here in Medicare. So Part A for hospital insurance premium, monthly premium mostly is free. And I have the premium and mostly. If you're 65 plus, you work 40 credits, which is meaning that you have work uh there's 4 credits a year, 4 credits a year. So 40 credits is 10 years, right? So um if you have done your 40 credits, then it's free for you. Part A, it's part A, and I'm emphasizing part A premium because insurance is much more than premium. But if you're under 65 and you qualify through disability, then you must be receiving disability for 24 months. If you're ESRD, immediate eligibility, ALS, immediate eligibility. Spouses may qualify through their spouse's work of record. You have to be married for 1 year plus. Spouses must have worked for 40 credits, right? Divorced spouses can qualify if marriage lasted for 10 years. So sometimes many of our immigrant homes, one person may be working, the other person may not be working. When you're filing your taxes, these are some things that you want to make sure you make sure people are your spouses are on, because then it helps affect the credits of each other, right? On this. So understanding these credits, and I know that you can go to the Social Security website and log into your SSA.gov, and Social Security keeps that credit, like to know how many credits if you want to find out how many credits you have. Um, you can go to SSA. I think SSA.gov is on the Social Security website, and then you can create an account there, and you see your SSA. At first, um, I know my dad used to get like a letter from, and many of our elders that are here, you may remember because I remember my dad used to get a letter from Social Security I think it was like every month or every quarter. But then I don't think they do that anymore. I don't know if they do that anymore. But they probably have moved it online, but it used to give information in terms of how much contribution one had made to Social Security. So that will be one of the ways that you know how much you have and how much contribution and all these things. But at least you want to make sure that if you have worked for 40 or for 10 years, which would qualified credit based on the amount of money per each year that was put in place, then so then the credits. And I will recommend that you know this as early as possible so that you are not surprised, because not just that you have worked for 10 years, but each of the 10 years should get to that amount qualification that was there. So for 2025, earnings have to be here. So each of the years had their own earnings. So if you were earning less, then it's not qualified, although you may be working, but it's not qualified towards the credit, right? So they just don't take it blanket like, oh, 10 years. No, it's 10 years, but there is an amount to it. So make sure you have that in mind. If you have passed those visa things, then you get the Part A hospital insurance premium for free. If you haven't, then it is the Part A hospital insurance premium is not free for you. If you have less than 40 credits, then there are two options here. If there are 39, between 30 to 39 credits, you don't get it for free, you get a reduced rate. 2025, the monthly premium, and this is only premium, the reduced rate is $285 a month, 2025. In 2026, it's $311 per month. So, and I know this has been recorded, but if you're working and you're not paying your taxes, or you're not filing taxes or things like that, you may get there and then you are surprised that, oh, my credits are not enough. And then you have to be paying 285 a month, or 311, or depending on how much year. And you can see that this is increasing between 2025 and 2026. So just imagine 2027, 2020, 2030, how much that money is going to be. So keep that in mind, that if you don't have the 40 credits, then it's not free, the Part A premium. Then if you have less than 30 credits, then you're paying $518 a month for 2025 and $565 a month for 2026, if you have, depending on the credit. So this is the first area of cost telling you that Medicare is not free. And this is even for the first one, this is Part A monthly premium that is free if you have your 40 credits. Now we are going to the hospital insurance, even the other costs. Just imagine you have your 40 credits, you have Part A monthly premium for free, but then there are other costs that comes with it, right? Apart from monthly premium, just like any other insurance products that we have, there are some other cost sharing areas and benefit limitations, which when you hit that limitation, then afterwards you have to probably be paying some money out of pocket, right? There are deductibles, so you have to be planning for deductibles. There are co-insurance, and co-insurance is like you are paying part of a percentage of the charge. There are, even if you qualify for your monthly free premium for Part A, you still have to take care of deductibles. You still have to take care of co-insurance, and there are some benefit stays. There are lifetime benefit reserve days. All these things that come into play. So as you plan, you have to be planning for these costs that will come in. So just imagine someone who doesn't have the 40 credits, right? Then that person is paying the premium plus paying all these other costs that comes with it. So these are, as I'm saying, like Medicare is not free, and it takes these planning for these costs to be able to have these benefits even when you get there. Then we get to Part B, premium, right? Even if you have your 40 credits and you have your Part A premium covered, you still have to take care of Part B. And Part B is covering like your providers, the charge from the providers. Part B standard premium for 2025 is 185 a month. Part B standard premium for 2026 is going up to 202 a month. So you have to be planning for your Part B premiums, and this is if you're doing traditional Medicare, you have to be planning. And even if you plan for Part C, or sometimes I will always say like plan for all of them because you never know when you may switch and things like that in life, and life changes. So you have to be planning for these premiums. So for Part B insurance, that is those are the premiums, and it's not free. Uh, if your income is more, there's something called IRMA, that depending on how much your income is, there's also some extra adjustment amounts that you need to add on to the premium. Just these are standard premiums. So if you have high income at that moment in time in your 65 and above and things like that, there are extra costs that also comes with it because of the of your income that you have. Um, then Part B, other costs that comes, you have to also deal with deductibles. You have to deal with co-insurance from the Part B's perspective. Then Part C, there is the Part C is not free. You get the Part B premiums, and it's interesting because don't forget that Part C, as we've been discussing, as a Part A plus Part B, right? So there's still some things that the company is pulling all of them together in all in one, but they are pulling money from your Social Security check. They are pulling money if you don't have enough in your Social Security check. They will send you a bill or you pay for the premium, all these things that are coming in. So Part B, you get 185. So this Part C. MA plan premium ranges 0 to 200. They combined monthly cost maybe 185 to 385. You're out of pocket, and there's some out of pocket max. There are co-pays that you have to deal with. All of them are needed even in Part C if you choose Part C. Then Part D plans, Part D is also not free. If you have your traditional Medicare and you chose A and B, and now you have to find your D, you have to make sure you have money for your Part D. The average premium for a standalone, which is mostly if you have your traditional Medicare, then you have to choose a standalone PDP plan, Part D plan. The premium for 2025 is 38. 2026 is going down a little bit, 34. If you have Part C, which comes with a Part D, which is called MAPD, then it's 13 and 11. And so you see different cost sharing. You have to take care of co-pays. You have to take care of maximum out-of-pocket, all these catastrophic things that comes with Part D. But I think what I'm intending to say is like, you have to have in mind that Medicare is not free and there are some costs to it. So I'll just give a quick scenario. Although Part C, and I'll go there as I get there. This scenario is someone who has Medicare, right? They chose original Medicare, the first one here, original Medicare, plus a Medigap, plus Part D. They are paying the Part B premium, 185 a month, which is 2,220 a year. Medigap, they have to find their own Medigap plan, 150 again. Then Part D premium, 46. And then, so ultimately, and this is using 2025 numbers, so ultimately you are paying 4,572 a year before even healthcare services. You've chosen the traditional Medicare route. On the other hand, if we come here, you've chosen the Medicare Advantage route with drug coverage. Your premium, Part B premium, 185 a month. You are doing 2,200 a month. Your MA premium might be this amount. Many of the MA plans have zero premium. So and I explained a little bit last time but then you get to a total of 2,200 a month, or 2,000 between 2,500 a month plus your copays and other things. You're looking here is 4,000, here is 2,000. The same question, like, okay, so why would people choose here, right? The same thing, the flexibility. You have all these things, but the philosophy of Part C is that you're not going to Oklahoma for care. Why should you be putting money together or actuaries to put in money together to get Oklahoma and everybody bundled together? No, you are here in Maryland area. Let's use Maryland people. I can restrict the places you go to, but I will give you more, right? Versus you have it. It's just like I have only one son, right? Or a family of one or a family of three buying a huge minivan, right? Not using it versus someone who has like four kids, five kids, and then they need a bigger car, right? So that is where the philosophies behind all these things is like, no, you are not going anywhere. You are just in this area. Why should you be paying all these like right? Zero premium, your social security check is already small, so low premium. So all what the philosophy here is that I'm gonna get all the money and then I'm going to create a benefit package for you that is low cost, but you get more benefit, but it's going to restrict your care because those that I have, those that you'll go to receive care, I already have contract with them. The philosophy of this one is that you can go anywhere you want. And if you go anywhere you want, then nobody knows how much the people are going to charge you. So then you have to pay for the cost, right? And those are the philosophies behind these things. Scenario three here is that someone who has no 40 credits, you must buy the part A because now you have to pay for the part A. You add the part A premium to it, your part B premium to it, then you add all the other things to it. Part D, now you're hitting almost 8,000 a month. And this is from 65 all the way till whenever you God calls you, right? So all these are all decisions we make, and we make them now. I know my time is almost up, but I'm almost done. I was hoping I could leave more time for today, but the coverage option that you're choosing will gonna affect your costs. Will gonna affect what you can do, and therefore it's going to affect your coverage restrictions or your coverage flexibilities and things like that. And Medicare is not free, so we start planning for it now. If you are not there yet, it's good that you start thinking through it, start thinking it as part of your retirement package or retirement plan. Start thinking through it now. If you're already there, now how do you put all of them together to make the right decision for you and your family? And I think today's ending, so we might probably have to find time on the penalties and some of the cost saving avenues that are there, depending on where you are. But I will pause here. I think that is what I have for today. Oh, this is the last slide. Um, Last week, Dr. Amankwa asked the question, right? Just thinking through what we do have. And I think this goes to the first slide that I showed on the people not getting to 65 and also some of the questions that are our experience, right? Many of us from what Auntie B and the audience that are here, low income. So basically, like, if I have low income, I'm not gonna choose Medicare, traditional Medicare. I don't even have money for the Part B premium. I will choose I'm more likely to choose a Medicare Advantage plan because I'm not going anywhere. I'm around here, and I'll choose a plan, and then I'll use the benefits here, and that is what you see in the research or some of the publications. Who are Medicare Advantage enrollees, and how do they differ from fee for service? Mostly Black and Latino beneficiaries enroll in Medicare Advantage. Um, Socioeconomic wise, across race and ethnicity, greater proportion of Medicare Advantage enrollees are low income, low high school graduation rates and than fee for service, and that is pretty much because of some of the cost structures. If you can either pay the money upfront and have restrictions in the back, or you do restrictions up front and then you pay the money in the back. It's all the choices that we all make. But ultimately, I think what I'm emphasizing, Medicare is not free. Medicare has at a cost. And as low income or whatever it is, we have to be planning for it. Or our parents, we have to be planning for them with them. Parents, you have to be planning because it's not free. And I will pause here and I will open it up for questions and questions for now. I think I'm seeing some things in the chat. I just haven't been able to get it, but yeah.
Dr. Prince, thank you so much. I think we are open to questions now. Okay.
Oh, I think
Hello.
Are you muted? Is everybody muted?
there is a
Hello.
Zoom.
Oh,
There is a
Hello.
question here. If you don't mind me answering that
Hello.
one, then we can go to the next one.
okay.
So the question is, what role does the deduction from our paychecks help or do in payments in the Medicare when retired from work? We talked about the Part A is free, right? So the Part A, as you're paying, your paycheck helps you to get there if you do all your credits. And the other thing is, just imagine if we were not paying in now. Healthcare cost in the US is ridiculous. So even with all the subsidies and all the things, and actually it was healthcare that caused the government shutdown for all these days. Healthcare was the key thing that caused the government to shut down, the longest shutdown we have. So if that wasn't in place, I think healthcare cost was going to be ridiculously high. So even with all of them, we still pay for all these things because healthcare is so expensive in the US, especially. So they play a role, just that healthcare is expensive in the US.
Hello.
Okay, now someone can.
Sorry, do you want
Hello.
to share your screen or you want to leave?
Yeah,
Hello.
let me stop sharing.
Uh-huh.
Hello.
Yeah.
Hello.
Yeah,
Yes.
we can hear
Yeah.
you.
Prince, you were saying that medical advantage it can change all the time. So if you say that, what does it mean? The monthly payment or the co-payment you were talking about, or what? If you say
Okay,
that.
okay, thank you for the question. So within a year, your co-payment, your monthly premiums stay because the plan benefits are for a year, right? So 2025 cost will stay 2025, your premium. Co-payment is a fixed amount, so that also will stay the same for that year. Co-insurance is a percentage. So co-insurance, depending on how much is charged, then that changes the price that you pay for the co-insurance. But what I meant is that plans change. That's why there's annual enrollment season, right? They know that your benefit, your needs will change, and therefore one year where your co-payments may be $5, another year may be zero, another year may be premium may be zero, another may be $1. So those are the changes because in Medicare Advantage, we are always looking at the data and making changes on the benefit packages. So that's what I meant, as opposed to fee for service. Fee for service do that, but the benefits for fee for service are fairly, I would say, it's mostly stable than MA that is like going and churning every time. That's what I meant. Is that helpful?
Some questions here whilst you're doing the presentation. So how do you get Medicare when you are self-employed? And then there was a mention of you qualify if your spouse, something about spousal eligibility.
Mm-hmm.
So what happens when you are married but you file separately? How does it affect your Medicare?
Okay.
Then the
So
third one, maybe one question at a time.
yeah, yeah. So the first question, sorry, let's do it one at a time.
Yeah. How do you get Medicare when you are self-employed?
Oh, when you are self-employed, when you are self-employed. So when you are self-employed, there are ways you still pay your taxes, right? There are self-employment taxes. You will see those on, depending on your company, your entity type. It may be sole proprietorship. So if you are sole proprietorship, you file just one taxes. It's all because you are the company and the company is you. So you file one taxes at the end of the year, you see the taxes being taken. If it's an LLC, then you are filing two different taxes, or it might be put together because a pass-through thing. And I'm not a CPA, so anything here, accounting things, go and look for the CPA. But you're paying your taxes in your LLC as a self-employment taxes. Sometimes you may have a C corp that you pay yourself, and in that case, if you're paying yourself a paycheck, then you see your Medicare taxes on that because I've seen that on that. So those are various avenues that you can still pay your taxes and get them reflected in there.
The second question was something about spousal eligibility.
Okay.
If your spouse qualifies and you've been married for 1 year, I think you mentioned something.
Yeah, I'm gonna go there quickly with that was the so what was the question so that I
Question is like if you are married but you are filing separately.
Oh, you're married but filing separately. The question, I think the filing of the taxes from the CPA is like different choices. File separately, file as household, file. So far as you pay, Uncle Sam takes his money.
Yeah, okay.
So far as Uncle Sam takes his money, it goes into the person's who paid the taxes account, right? How Uncle Sam takes his money. That is how it's like you can file as a household, head of household. You can file separately. You can file as a self-employed. You can whatever it is, so far as it counts, that's I hope it makes sense.
If one person is like unemployed, like let's say the wife is a stay-at-home mom.
Mm-hmm.
So how do they, in addition to it, how do they get the points? Remember you said something about a point system.
Yeah. So for example, if someone is a stay-at-home mom, but you are filing I'm hoping you are filing the tax together, right? Right.
Hopefully, at least your husband puts you
there. The person's name is on it. So you are is a married. So if you think from a more capital, let me say from a more market perspective, a stay-at-home mom is actually, or stay-at-home dad is actually working. Right. So when you file taxes, that's why many times you may have a stay-at-home mom, you file the taxes and maybe Uncle Sam may give you money back. Uncle Sam is not just being generous. It's just that, now with a family, with a second person, the third person, and think now your tax bracket has gone down. It's not that Uncle Sam is generous, right? So the person working as a stay-at-home mom, Uncle Sam is pulling the family together and saying, okay, for this family, for this household, this is the taxes that you would have paid. And therefore, that is how it works that way. Does that help?
I was thinking of it in terms of Medicare, that the person has not contributed the 10 years, but the person is on the spouse taxes all this time. They still don't qualify.
No. So I think this where so when Uncle Sam, now you file your taxes together, right? The taxes that were taken out either from your Social Security taxes, your Medicare taxes, they are being calculated for the household. Does that make sense?
Yes.
So it counts towards the household, everyone in that spousal household. Does that make sense?
Yes.
Yeah. So think from it from that perspective. That's why if you file taxes together and then you owed a much, like Uncle Sam will either give you money back or take some money back. Like you may be independent 1%, and then Uncle Sam says, okay, you owe more based on what you file as a household. So that counts towards, like, filing tax annually is more like a reconciliation process. So Uncle Sam is now looking back at the year and pulling everything together and reconciling everything together and say, okay, based on this, now this is how much you owe, this how much money I should give you back based on all the other taxes that I would have taken from that perspective. I hope that helps.
Yeah, but there's another question, and then somebody else has a question. Is there a way to plan for extra costs with healthcare? Is there any?
That's a good question, and I think that is that the answer is yes. Just like everything else, we don't know how much our overall cost is going to be, but definitely the same way we may be planning to, and as immigrants here, I can say, we may be planning to build our retirement house in Ghana. We may be planning to ship things to Ghana. We may be planning to, maybe here get maybe a life insurance, whatever, your 401k, all these things. Many times, I think the difficulty for us is that because we think we are paying in, and I think that's probably the miseducation. We think, oh, I'm paying in the taxes, and by the time I get there, Medicare is free. And therefore, we don't think from that perspective, right? You don't think that if we had thought that by the time you get there to retirement, my Social Security check will cover everything. People that have that mindset do not contribute to 401k or all these other retirement programs. Oh, Social Security will take care of me. Social Security will take care of me, right? But if I know that, oh, Social Security might not be enough, I have to plan for my other income streams. Then I may be thinking from our brokerage accounts, 401k, life, all the other things that financial products. And we need to think health products as well, because that can also be another way. And that's been my passion, that we'll be able to plan for healthcare the same way we plan for other part of our lives from that perspective.
There's a question
Another question.
There,
Adapa. Yeah.
yeah. So at 65 and working full time with healthcare benefits, do you have to worry about Medicare? So the answer is yes. The answer is yes. And maybe the next one that we go through penalties and other things will bring those to bear. Once you hit 65, I think in America, it's mandatory, right? Unless you have a qualifying plan, which maybe your workplace is offering something and therefore you are not thinking about it in place of it. But immediately you leave your workplace things, you have to go, you enter into something called special enrollment season that you have to sign up. Otherwise, you get within that period of time, otherwise, you get penalties. So the same, I wouldn't say at 65 start thinking about Medicare now. And depending on where things fall, you can say, oh, I have a qualifying plan and therefore maybe I don't have to choose part A now or part B now, but part A, and immediately you leave your qualifying plan. Now you'll get into special enrollment period, you need to get on, right, so that you don't get into these penalties. But definitely I would say care about it now, worry about it. You may not have it as your primary um, health insurance. You may probably choose only part A. You may have worked in, you have your part A in, and you have your part B from other place. I shouldn't be using the part B. You have your medical insurance benefits from another thing, but just make sure that you know all these to be able to align them well, that you don't get into these ridiculous penalties. So that's that's my recommendation.
Friends,
Yes, please.
you were saying that medical is not free. I know it's not free, but people get it free and some people don't get it free. Why? Because of the insurance company you choose or what?
There are several things, and I think the next probably going to be benefits and other programs, because when people are is for free, it's somebody's paying for it. It can be, that's where sometimes the Medicaid chimes in, right? Some of your cost sharing that you were supposed, your premium and all the things, it's not that it's free. It's that Medicaid, the state has chimed in because of your income. The state is paying that income, that things for you on your behalf. So that is when someone have them for free, even if you have part C and it says zero premium, it's because they have pulled things together to make sure that the mathematics work on the back end. And therefore to you see from the front end that is zero premium. But some mathematics in the back, we are definitely working on some mathematics in the back.
I think there's a
Did that
question
help?
yeah,
Okay.
that nothing is free. Somebody
Yeah.
is paying for it. There's a
Yeah.
question there's about
Can one stay on a blue red card and Medigap B and D alone or C? So if you have a blue red card and you have Medigap and you have a part D, as I had been sharing, right? The blue red card only, you will need a part D for your prescription drug, and you need a Medigap to help you pay for some of the cost sharing. So that is one track. Part C, if you have part C is bundled all together like the Burger King where you go and you grab your burger, right? All of them is bundled. If you have part C, you don't need a Medigap. You don't, it depends. Most part Cs now have part C and D combined. So many times if you have part C, it's probably you have part C and D together. But if you're on the first track, you have your blue and red card. All of them, you have your blue and red card, but you'll be mostly using your blue and red card plus your Medigap and your Part D cards versus using your Medicare Part C cards mostly. So those are the two tracks. Can you please review the Medicare Advantage against Medicare Is it a Medicare Advantage between the traditional Medicare?
Yeah, I think so. I think that's
Okay. So let me go back and share screen. Okay. All right. Let me find which slide that is on. So okay, this was the slide I had it. So for the original Medicare, uh-oh. All right. So for original Medicare, which is Medicare, all of them have Part A, B to it. Uh, the monthly cost is relatively higher from what we just discussed because it's freedom. This is just think of it. This is a company, right? If you leave people to go to anywhere to receive service, we all go wild. Just imagine like you go to a buffet and then the buffet says eat all what you want. You grab this, grab that. If you don't, you can taste it. If you don't like it, you throw in the trash. It's the how we all spend. The Part C is not a buffet. The Part C is a restaurant that you go and there are menu items that is like you select and then that's what you get, right? So that is how. Just think of it. I use several analogies for that, but so you have monthly cost, which is relatively higher because you have the freedom to choose any provider that is accepting Medicare. Um, you can get Medigap with it. Um, this one you don't have Medigap to help with some of these copays. They don't have extra benefits with them. It's only the A, which is your hospital insurance, and B, which is your medical things that is covered. You don't get dental. You don't get anything else. It's pretty much what you are getting is freedom. What you're getting is like if I'm in Maryland and I need a service at Mayo Clinic, guess what? I can go to Mayo Clinic. Mayo Clinic accept Medicare. I can just get up and go there, right? You get freedom. Somebody from Mayo in Minnesota comes. Oh, I want to come to Hopkins. You have freedom. You just get, and because of that freedom, you are paying. There are people who need that, definitely. Um, and it works nationwide. And the other hand is like they are giving you some restrictions because they're like the philosophy is like you live in Maryland. Most of your care you go to Hopkins, most of your care you go to right. So why should you be paying all this money? So I will restrict you, and even within here, there is HMO, there is PPO. So there are different levels. There is POS. There are different levels of restrictions that you may have. Um, and what is being done, and this is where I'm saying the math is working in the side and in the background is like the same money that the government is given that you may use here. These companies come in and say, they come to the government and say, hey, you give me that same money and I'm going to design a benefit for this person that will not take a lot of money. And I know this person receives services within around their neighborhood. So I will restrict them just a little bit, or depending on which one you have, or there might be a huge amount of restrictions. Um, but the person is not going to pay anything. And you think, oh, yeah. So in some way or the other, you are paying with something. And that is the difference. And it may work for all of us. It's the same thing even at work. You have work insurance, you have HMO, you need a gatekeeper, you need referral, it's pretty much the same thing. And they have prior authorizations. Many of the providers hate that because you have to get prior authorization. The reason is that they have received the money and they have to manage that money. So they want to make sure that that money is well managed. On this side, the money's coming straight from the government, and it's like, okay, buffet, just go. So there are people who that may work for them. Definitely, that's why it still exists. So that's the difference from a philosophical perspective, and that drives the different details of them. I hope this helps.
I think there's a question here.
Stop sharing.
Try and
Uh, can you review Medicare? Okay, I just finished that. So what measures do we have to do now with our health so that we do not involve ourselves in chronic diseases that will bring high cost in the future? That is a whole different topic. You need a clinician for that. Um, as an Adventist, if you're an Adventist, if you're here, new start. That's the purpose of this, right? Because the more I'm able to manage not just the cost but my health now as you grow, the better, all the new like all the things that are being talked about, the more chronic conditions we have. And sometimes it's not by our, anything we did. It's just sometimes some are genetics, black, predisposed to diabetes, high blood pressure, hypertension, those three things. But there might be some factors that we can help to help either decrease the likelihood or make it delay, or we have it but the impact is different. And all these we plan not only for the cost of care, but we plan for the health itself as we all grow together. And that may take a whole different thing on that, but that would be my 2 cents. I'll lead that to the clinicians that are on the line. Yeah.
So we have a question, and I think that will be our
Okay.
last
A
question.
person was on Medicaid and received all their health care plus drug coverage for free. Yeah. Now, this said person is 65 and has been put on Medicare. Some of their diabetes and blood pressure medication, drug, and other were free are not covered. Yep. How would you direct this person in choosing what they need for coverage? So there are several things, and I think this might probably go to the extra help, looking at the penalties and the help, right? Medicaid is free for the person because the state is paying for it. Right. Now the person jump on Medicare, the person depending on which pathway the person choose, traditional Medicare, um, you can still get the Medicare extra help things that Medicaid will come in. And that is a term that is called dual. So you may probably see dual plans. If you choose traditional Medicare, there are some extra help things that the Medicaid will come in to cover, just like your person had the Medicaid. If you choose a Part C path, you may choose a dual plan, and the dual plan is pretty much doing the same thing. They are getting the Medicare money from the federal government, the Medicaid money from the state, and pulling them together to create a benefit package that is for that person. So the money is still being used from other sources and other things to pull it together. But in this case, depending on which pathway the person have chosen, there are extra helps in Medicare that comes in. Some of them are Medicare programs. Some of them are Medicaid programs that you have to find and to be able to pull together so that the person may have the right service, the right medications and other care that they need. So far as you do all of them and you make sure you have coverage for both of them. And Medicare and Medicaid are different. So the thought, and now with the one big beautiful bill, if you have Medicaid and all these things, like now, Medicaid redetermination was annually. Now it's going to be every 6 months. If you have Medicaid and you have Medicare, now you have to be redetermined every 6 months, like starting next year. So you'll be home and they'll tell you your Medicaid is like expired in 6 months. You're like, what? The new law, the new bill is going to do that. These are all things that have changed that we all have to keep in mind because if your Medicaid is not paying for it now, you don't receive your benefit, your medications and other things. You are not able to afford the payment, and it affects your health. It's all the same person, and it's gonna get complex in this world. But once you're able to find a professional or the needed resources that are able to give you that extra hand, you can better. It will be better off than trying to navigate through these things yourself together. Yeah.
So you mean
Thank you.
if you reach 65, you have to find a professional to help you. You can't do it yourself, isn't it?
I wish I could say you can do it yourself, just based on what we have covered so far. Just based on what we have covered so far. Um, I wish I could say you can do it yourself, but I'm in healthcare. I think this is even still complex to me. finding professional. There are so many other different kind of professionals. There are navigators that the state provides. There are brokers who help with, especially if you're doing Medicare Advantage. But and as I speak, like some of my passion, and I hear this over and over, is that some of the brokers, they just enroll people. They are coming in from a selling perspective. They just enroll people, and I'll see you next year, when annual enrollment opens again, So just understanding, instead of coming in to better understand what the person's need and helping the person, it's, but it's just find a professional who is knowledgeable and who cares enough to be able to be a partner with you through this. Um, and it's better to do that than trying to navigate this yourself, which the research says many people who are choosing Medicare, actually, like on average, people have 35 to like 33 to 30. Some people even had 39 plans to choose from. If we give you 39 MA plans, like which one are you like which one are you choosing from? So it's I will always encourage, if you have a trusted partner to help you navigate through this. Plus, you having the knowledge, because at the end of the day, it's you. So have the knowledge to at least gauge them and poke them in the asking the right questions to do the right things for you.
Oh, thank you so much. Thank you all so much for staying. I'm so happy you came, and I'm so happy Dr. Prince came today. I'm learning a lot. I'm sure everybody is. It's a lot of information, but with a breakdown, we know we can do it, and we don't have to wait too late to learn about Medicare. So I'd like to thank all of you for coming today. Our next program will be on suicide awareness and prevention, and it will be on December 11th. And I'm inviting all of you to join again. We know suicide rate is very high, especially among teenagers. So we'd like to invite you to join. But please don't forget Medicare, all that Dr. Prince has taught us today. If you have any more questions, I think he's ready to help. Yeah, he posted, you can go to his website, healacademy.com. And I think, Dr. Prince said he was going to give his phone
Yeah,
number.
I was gonna share something. If you don't mind,
Okay.
I can quickly, do that. Just give me just a minute.
So please use your phone, take a picture.
Yeah,
and
let me quickly do this.
say allow.
I can, yes, please. Okay. I just have I think the last slide here has, yeah. So if you don't mind, you can reach out to me, phone, text, email. Sometimes I can be very busy, so just you reach out to me and we can talk. And if you don't mind doing like this evaluation for me, it's helpful for me. So if you, that would be really appreciated, very, very appreciated. So
We'll give ourselves a little time to do it.
yeah, where's the Zoom thing?
Yes.
I'm gonna put it in the chat, but okay, I found it. Yeah, but please don't hesitate to reach out. Yeah, I just put the link also in the chat. Okay, I think we can, John, if people have the link and things.
You have a link. Have you taken a picture of the phone number? So if you have any questions, you can reach out to Dr. Prince, or you can go to my website, www.myafridreams.org, and you can also send your questions. And we are inviting all of you during this time of giving from December 2nd to donate to our organization so we can continue offering you free programs. Thank you all. Good night. God bless you all for coming today. Thank you, Dr. Prince. Thank you once again.
All right. You're very welcome. Thank you. Okay. Bye for now. Happy
And good
Thanksgiving.
night. Happy Thanksgiving to everybody. Thank you.